Hi, I'm Dr. Richard Freeman. I'm the Chair of Surgery here at Dartmouth, and I want to talk to you about electives that you might want to consider in your third and fourth year to prepare yourself for a surgical career and a surgical training program down the line. I think electives are extremely important for several reasons. First of all, if you're having a hard time figuring out what direction you want to take, sampling surgical specialties, particularly subspecialties like ophthalmology or ENT or orthopedics, is very useful just to give you some kind of taste of what it's like to practice in those fields. But the other advice I would give in selecting electives, and if you're having a hard time deciding, is to try to always make choices that give you more opportunities, not less opportunities. Now that's easier said than done sometimes, but my feeling is, and I'm biased, that by choosing surgery in general, you can always branch out into other subspecialties of surgery, and actually it's not very difficult to go back into medicine or pediatrics or some other specialty if you decide surgery isn't for you. It's harder to go from the non-procedural specialties like medicine or pediatrics and change once you're in a training program back into surgery. Most times you would have to start over again. So if you think surgery is possible for you, I would encourage you to try and get a taste of surgery as early on in your third and fourth years as possible to help you make those kinds of decisions. Once you get further along and you've sort of decided that surgery is really what you want to do, I think electives in the surgical subspecialties, particularly in critical care and some of the other more advanced areas, are very important to give you a better depth of what surgery and complex patients really look like. A lot of questions come up about whether you should do away rotations, and I think they are extremely important, not so much as an audition for you at the program to which you attend. The research would suggest that those auditions, at least for surgery, don't impact your acceptance or denial at a training program that much. What it does do for you, though, is allow you to audition the program. And by being there, you can get a flavor for how happy the residents are, what the training program is like, what the faculty is like, what the city is like to live in. All of those factors are very important for you in making your decisions and your ranking decisions when you decide which programs to rank as a high priority. So I think it works both ways. It's always better to be known than not known, but I think it's at least as important for you to look at these away rotations as auditions. In the Department of Surgery here at Dartmouth, we are aggressively developing global surgical programs. And I think if you have an interest in global health in general, doing a rotation or doing an experience in a foreign country, particularly one in a developing area of the world, is very helpful. And I know this year when we looked at our intern applicants, we looked very favorably on students who had had those kinds of experiences. I would also say, though, that it's not just about delivering care in a very resource-constrained environment. Having experience in a more developed area, but in a completely different health system, like Canada or the UK or somewhere in Europe or Japan for that matter, is also extremely valuable. Their systems are different than ours, and each have their strengths and weaknesses, but understanding those strengths and weaknesses from afar will help you understand our system better and hopefully help you change it for the best as your career progresses. A lot of questions come up about competitiveness, and there are, as in most specialties, very competitive programs and not so competitive programs. I would recommend that you get a good sense from your advisors, both in surgery and at the dean's office, about where you fall in the range of competitiveness as an applicant in a surgical subspecialty, if that's the direction you're going to go. I think everybody should try and apply to a few programs that would be stretches, that would be highly competitive for anybody, that would be wonderful if you get there. And I think everybody should apply to programs that might not be so competitive and that would be more what you would call a safety program, and then have a range in between. You never want to sell yourself short, and I think Dartmouth students are, for the most part, highly competitive when they come out of training here. And the fact of the matter is, the more highly competitive, more favorably reputations programs opens doors for you that the less competitive programs may not when you get done with your training and you're looking for a career down the line. That's a fact of life, and I would encourage you to look into that. I would also say one other thing. As you progress through your fourth year, and once you've made your determinations about what specialty and where you're going to apply, I think it's important to try to take electives in areas that you're likely not ever going to experience again. So, for example, if you decide to apply in general surgery, doing a cardiology rotation or infectious disease rotation or a gastroenterology rotation or even an ethics rotation in informed consent, those kinds of things I think will be invaluable for you to function as an intern and beyond in your training. And you likely won't have another chance to focus on those particularly important specialties. So I would encourage everyone to do that. And likewise, if you choose a medicine specialty, I would choose to do surgical related electives at the end of your fourth year, again for the same reason. Transition from the third to fourth year is difficult, particularly when our curriculum is changing significantly going forward. But again, I think as you transition from wondering which specialty and which training programs you're going to pursue to finishing medical school after you've made those decisions, you should transition from gathering information to make the training decisions to gathering knowledge that you might not have a chance to acquire otherwise. The faculty of the Department of Surgery and myself in particular are always willing to help you and advise and try and help you make the best choices for you, and so we welcome you to come here anytime and reach us to try to help with these really difficult decisions. I always say it's not fair that you have to make these decisions without ever having experienced any of this ahead of time, and the most you can do is try to gain a little bit of experience through your elective rotations that you have. So, thank you.